Hello, it's Dr. Rhonda Johnson. Today is Sunday, January 22nd, 2023. Today, folks, I'm talking about blood clots and COVID infection. Now, there is a lot of data that has accumulated over these past 2 to 3 years showing that there's a higher risk of blood clots in people who have had COVID infection. Now, COVID infection causes a hypercoagulable state, which makes it more likely that the blood will clot. Now, it's not just related to blood clots in the veins. You know, the veins are those blood vessels that carry the blood from the tissues back to the lungs, but can occur in the arterial blood system. That's blood system that carries fresh blood from the heart to the body. And COVID infection can also cause microvascular clots, which are tiny clots in the cells that line the blood vessels. Now, today I'm summarizing a study that was published in the prestigious journal Circulation in September 2022. The study came out of the UK. The researchers looked at people who had blood clots following COVID infection before the COVID vaccines were introduced. So how was the study done? Well, I'm glad you asked. They looked at electronic health records of 48 million adults in Great Britain's national health system, people who had COVID, people who didn't have COVID, people who were hospitalized, and adults who did not require hospitalization between January and December 2020. Remember, before the vaccines. They found 1.4 million diagnoses of COVID-19, and what did they find? Overall, blood clots were rare. Venous blood clots were more common than arterial blood clots. And the risk of the blood clot was highest during the first week after a COVID infection. The risk for an arterial blood clot was 22 times higher than someone who did not have COVID, and it decreased between 27 and 49 weeks. Now, for venous blood clots in the first week of a COVID-19 diagnosis, the risk of a venous thromboembolism, that's a blood clot in the veins, was 33 times higher in someone who had COVID than someone who didn't. By third and fourth week after diagnosis, the risk was about down to 8 times higher, and between 27 and 49 weeks, the risk was still 1.8 times higher in someone who had COVID than someone who never had COVID. Now, their UK study also showed that the risk of having a blood clot was higher in Black and Asian people. Now, what about here in the U.S.? There have been lots of studies that showed the incidence of blood clots after COVID appears to be greater in men who are hospitalized and in persons with obesity, cardiovascular disease, high blood pressure, and diabetes. So why am I talking about this, folks? Why do I think this is important? Well, just to reiterate, COVID disease can cause a hypercoagulable state that makes your blood more sticky and more prone to clots. The risk for venous thromboembolism of clot in your vein is increased and may persist for months after COVID has resolved. Now, although this study was done in the UK, I think it's applicable outside the UK, and the study is very valuable because it does not include people who have been vaccinated, because we know these anti-vaxxers like to blame everything on the vaccines. Well, this study showed that the risk was from COVID infection, not the vaccines. Now, we have had many variants that have come since the study was done. No matter what variant is dominant, the risk of blood clotting has continued. Perhaps it's related to an inflammatory effect that the virus elicits. I'm not sure what causes this risk. But the bottom line is, given that there is an increased risk and it can be elevated for close to a year, experts say some people who have COVID infection should be screened and monitored for the evidence of any risk factors that can be mitigated by preventive therapies such as blood thinning medications. So folks, do me a favor. If you've had COVID recently, even if you've had mild COVID, talk to your doctor about your risk of getting a blood clot and, see if you are a candidate for blood thinning therapies for a short period of time after your COVID infection. Again, talk to your doctor. Don't ask me. I won't be able to tell you what to do. Talk to your doctor. All right, that's my message today. Take care, folks, and be well.